So, hello everybody. So, we have Dr. Manish with us, we have Dr. Ramya, and a lot of students who have passed their exams. So, how are you feeling? First of all, I just wanted to take a quick review of our mentors who worked really, really hard for your success. So, yeah, we are starting from Dr. Ramya. Hi, Dr. Ramya, how are you feeling? We have so far, I guess, 50 plus students that who have passed their exams. How are you feeling now?
I'm very, very happy for all of them. Hearty congratulations, guys. All your hard work paid. So, and not only all those who have cleared, those who didn't clear also, once again, they can try and definitely they'll clear. And I think all of you definitely participated very well. And yes, I definitely remember Delphine, everyone answering so well in the classes and practicing in the workshops. Hearty congratulations, guys. Hearty congratulations. Enjoy your success.
Yes, many, many congratulations. Dr. Mavish, can you hear me?
Yes, I can. Hello, Mafia. Hello, everyone.
Hi. So you are, I was seeing your journey as well. You're so close with the students, keep motivating them along with the other mentors. So how you are feeling? A lot of students are writing us in multiple groups. I don't even remember the groups because there are a lot of groups. We are helping students like in so many ways. So we are receiving messages. So how you're feeling? After that, we'll
I'm
ask the
so,
students.
so happy for the January batch. And I've told you before that this January batch was most amazing one because we had a lot of wonderful students who were working so hard and they were really, really dedicated. And you can look at the score, it's mostly above 85, and it's a wonderful score, which shows that the students did hard work and efforts for a lot of months, and now they have got the result. And definitely every time when a batch is getting the result, it's like we are getting our own result, and it's like a happy day for me. Congratulations everyone who got the result, and they have passed the exam, and they have made us so proud. They have made us so happy. Thank you so much all the students
Thank
for
you so
doing a
much
lot
for
of
the
hard work, and
sorry,
this
I
is such
have
a
to
happy
cut you
evening.
off because, Dr. Manish, I have to cut you off because there is some disturbance from Dr. Javeria's side because she has passed the exam. Hi, Dr. Javeria, can you hear me? I know you are on your way. No worries. Hi, Dr. Javeria, can you hear me? Asma from the background, can you please mute the mic? The mic, can you please mute it? Okay, thank you so very much. I guess Dr. Javeria is on her way to home. So we have so many people who have passed their exam. I just wanted to ask, first of all, Dr. Rabia, can you hear me? Am I audible? Dr. Maria, can you hear me? Can you please open up your mic and share your celebration and this moment with us? She can't unmute her mic. Okay, we have Dr. Desri with us. Hi, Dr. Desri.
Hi, hello everyone. First of all,
Hi.
I'm so sorry I'm in the clinic, huh? I cannot stay longer, but I would like to congratulate everyone who passed. And for
Thank you
those who
very much.
not make it, please don't be disheartened. We will be with you in your next attempt. Congratulations, everyone.
Congratulations. Thank you so very much, Dr. Desri, for your kind words. So we have our chief mentor with us as well, Dr. Helmi. Hello, Dr. Helmi.
Hello, Mafia. Hello, everyone.
Hi, how are you, Dr. Helmi? So again, we are on this point that we are celebrating another wonderful batch, and we have so many past students. What do you say? This is another achievement. It's been like a long time we are celebrating badges of successful badges for MRCOG-1. How are you feeling?
Yes, Alhamdulillah, we are doing our best to help our colleagues to pass this exam smoothly and easily. And I'm so proud of our colleagues who are doing their best. And I have heard about those who got very high scores, mashallah. We are
Yeah,
so proud of them.
91%.
So congratulations, everyone, for your success. You deserved it. And of course, who not could be able to do this exam, this attempt. Of course, this is the life. Sometimes we get what we want easily. Sometimes we face some difficulties. It's okay. So we are not going to give up. Of course, we are going to try again and again until we achieve our targets, inshallah. So for all those who couldn't make it this time, of course, don't be frustrated. That's a trial, and of course, next time you are going to do it. And of course, congratulations to all those who cleared the exam. And of course, we are waiting for you, inshallah, in part 2. We are going to help you as well in part 2 and part 3.
Yeah,
And
definitely. We'll help
I
you.
wish that mid-exam will offer you the best service to clear the MRCOG exam, inshallah. Thank you so much, everyone.
Inshallah. Thank you so very much, Dr. Heaven, for your kind words. Okay, we have Dr. Ala with us. Hi, Dr. Ala. Can you hear me? Yes, for all those who are writing in the chat box and praising our backend team, our mentors, I want you to please open up your mic and be with us so that we came to know that how you're feeling now after passing your exam. Dr. Sarah, thank you so very much for your kind words. I just want you to please open up your mic and share your feelings with us, that how you're feeling, how was your journey? I guess Dr. Mavish, you will say, then they will open up their mics.
So
Because we have so
I'm
familiar
very
names and we
happy.
are
I'm
writing.
reading the messages in the groups, and everyone is sharing the score. The score is wonderful. Really wonderful. Getting above 80%.
इंटीग्रेटेड सर्किट है इसके अंदर
Backend team, can you
उस
please
सर्किट
mute
की
Dr.
Again,
Nafia's
yes,
रेजिस्टेंस
mic?
हाई रेजिस्टेंस
a lot of background noise.
Yeah, it's Dr. Nafia's mic. So backend team muted that. You
No,
please
actually,
continue.
2 to 3 people together they opened the mic. Okay, so doctors, all of you who have joined the session, actually, it's very important to realize that this is the first step. This is the first step of becoming MRCOG, and there is a long journey ahead. And as Dr. Helmi has said, that you will be joining us in the part 2, and now the coming exam, the part 2 is also a difficult step to take. So making up the mind is very important. We are also organizing some sessions in which we will guide the students who have not passed the exam. And those who have passed the exam, they also should be planning for the coming parts. So keep in touch with the med-exam team. They will be giving you the guidance and the knowledge about coming parts also, because this is not like you have got everything after passing MRCOG 1. There is a long journey ahead, but taking first step was the most difficult thing. And all of you who have cleared the exam, you are done with taking the first step, and now the rest of the journey is so obvious that yes, you are going to become an MRCOG like in some years, and definitely MRCOG, the whole med exam expert team is with you. So we have
Yes, not we are
a
with
lot of
them.
doctors. Let
Yes.
me read some messages of the students. We have a doctor, and she is telling me that she passed the exam with 81%. And she was taking help from the med exam team. She was not a part of the regular group because she only took the MRCOG course, and she studied herself because the area in which she was living, it was remote and she couldn't connect with the website. And I'm so happy that her hard work is like paid off and she has got wonderful score. Congratulations, doctor. And in our WhatsApp group in which we collected all the students are still sharing the scores. So Mafia, we should invite them to the session. We have Dr. Shehla, who got a wonderful score. We have Dr. Hina Ali. She has got
Yes,
wonderful
we have
score.
Dr. Maya Vyas
Dr.
because
Monia,
I think, yes, we have so
great.
many
She got
names.
82%. Wonderful,
Yes.
wonderful, Dr. Monia.
Yes.
Dr. Pranshi has got 86%. Well done, Dr. Pranshi. All of
I
you.
don't know the name,
uh,
but there is a name, iPhone. She just messaged, ma'am. I just prepared for 1 month with your guidance. I did it with 73%. I'm so happy for this, ma'am. We just wanted to name your, we just wanted to know your good name, iPhone. Can you please open up your mic, or even you can share your reviews by opening up your mic, please? Or can you please tell us your name?
Hi, ma'am. I'm Bhavani Kavati.
Okay, it's
Actually, your voice is a little bit low. Can you please?
Hello, ma'am. Am I audible, ma'am?
Yes, please.
yes,
Yes, you are
Yeah,
yes, you
audible. Please
are.
talk.
yeah. I'm Bhavani Kavati.
Okay, doctor, how are you?
Yeah, I'm fine. I'm so happy for this. And
As if you
without you,
should be. Yes.
I might not have not done this, ma'am. And thank you so much. I've just prepared for 1.5 months. I haven't used any other resources except med exam, videos, and mocks. And the
Actually,
5-day workshop. And the
come
5-day
on.
workshop was extremely helpful, ma'am. Thank you so much.
That's great, Dr. Bhavani. I'm so happy you have got a wonderful score. And yes, you have shared your reviews about the workshop. Let me tell you that the workshop was all about the important points of MRCOG 1, and students who revised all the important points in the last week of their preparation just before attending the exam. And they were all prepared. And I'm very happy when students say that they had already read all the important points, and when they're attending the exam, they get a lot of questions with which they are familiar with. So what's happening in our life, if we are studying something right before the exam, we perform well. So it's a good thing that you attend the workshop, and the importance of the workshop is really, it has a lot of significance.
Yes, ma'am, workshop really helped us a lot, ma'am, especially for me. And the important points that you have just dropped day before the exam was like those were like really important, and many of them were in the exam as well. And I just love the important notes collection as well. Thank you so much for that.
So sweet. We have Dr.
Thank
Nafia.
you.
Dr. Nafia,
Yeah.
congratulations, first of all. I'm so happy that you passed the exam and you are a part of this celebration session also. So it's really
I
a
guess
great
Dr.
thing to
Maybe
hear.
she's for July batch, but we have Dr. Kurat with us. And she said, thank you to all the mentors. I can't believe that I passed. Dr. Kurat, can you please open up your mic so that
Yeah,
we
this
can
message
hear
is
your
from
lovely
Dr.
voice?
Kurat. Okay, okay.
Yeah.
Dr. Kurat, yes.
So we want to know your exciting voice, Dr. Kurat. Can you please open up your mic? Even we have another message, Dr. Mavish. I want you to read that. We have Dr.
Dr.
Lucy.
Sarah is saying this was my second attempt. I got 67% last attempt. In her last attempt, she got 67%, and now she has passed the exam with 84%.
Yes, that's
She's
really, really
very
important
happy.
point.
Okay, great. Great, Dr.
Dr.
Sarah.
Manish, do you think that we have so many students, if they didn't make it for the first time, they get like, just like Dr. Sari said, and the biggest example that they can achieve the exam or they can get a good percentage in the second attempt. If you didn't make it in the first attempt, that doesn't mean that it's the end of world, right?
Samafia, what could be the reason? What do you think that students cannot clear the exam in the first attempt? What do you think?
I guess it's the focus. They divide their focus, because every time in every session I say that you must follow one path. Once they go on the multiple paths, they got disturbed, they got distracted, and just they lose all the hopes, because they think once their seniors who have their you can say their learning pace is very strong as compared to them, so they suggest that okay, don't need to go with the, like, they suggest them, don't need to do for workshops, don't go for recalls or any other stuff, because they have, it's their second attempt, so they have already done it, means they lose their focus. I think this is the main reason they didn't make, if they didn't make that.
Yes, and another thing which I think that students cannot clear the exam in the first attempt because they are not oriented well. I'm sure that if a person is already done with the basics of the OBS and Gynae, and we are already done with the MBBS, MRCOG 1 is definitely not a difficult exam if you take guidance and if you read the correct resources. So we keep on focusing that our batch students are getting updated materials and they are getting everything updated, all the updated guidelines, all the updated materials. So they are never deficient of the knowledge also, and they never like solve the question in a way that they are reading all the information. So what happens? We have another doctor, Dr.
Dr.
Madhubanti
Anis.
Mukherjee,
Yeah,
and she
yes,
has
yes.
also passed the exam. And I'm
That's
really happy because she was struggling a lot and a lot, and it was difficult time for her for the study for some personal reasons. But she has made it, and I can't tell you,
that's
I'm
really
so
good.
happy.
We have Dr. Anisa. Dr. Anisa is saying that honestly couldn't have done it without you all. I have a newborn and 2-year-old. Okay, that's a brilliant job, Dr. Anisa. I really, really want you to please open up your mic if you can, please.
Hello, everybody. Thank you so much, everybody.
Hi. Hello, welcome to the session. How are you doing, Dr. Anisa?
Hello, doctor. Congratulations.
Thank you, Dr. Mevish, so much. Your workshop was just brilliant. It helped to focus all the guidelines, all the revision, and I'm just so grateful to all of you. Thank you so much.
Thank you
So
so very much.
sweet.
Okay, we have another name, Dr. Mavish, with us.
Yay. The name similar to me, and she has also got wonderful score.
83%, Dr. Laika, if I'm pronouncing it right. I passed with 83%. Thanks a lot to all team members of MedExam Expert. You are always welcome, everybody. So what do you say, Dr. Mavish? Dr. Laika passed with 83%. A good number
It's a
it is,
wonderful
I
score.
must
It's a
say.
wonderful score, and I'm sure the score is just not a representation of the knowledge, the clinical knowledge, or the knowledge of about the medicine or obscany. It's actually the representation of all the struggles and efforts a person has made during the journey of the preparation. There's a person. I was reading a message. She's saying, Anisa, Dr. Anisa is saying that she has a newborn and a 2 years old. Like I can't
Yeah,
imagine studying two little babies around me, and she has just made it, and the percentage she has got is so amazing. So whatever the score you have got, we have another doctor, Dr. Mariam, and she was saying like I wanted to get more scores, and I was so happy that she has just made a wonderful score of above 80%, and she was saying that she wanted more and more marks. So I was telling her that this score, the pass percentage which you have just reached, is getting a reward for all the struggles you have made throughout this journey. And there is another doctor. She is saying, I got exactly 68%. I'm very happy for you, doctor. You have just you just nailed it with a wonderful score. Good luck for
no
the rest
doubt.
of the journey. And she's saying, I passed, Alhamdulillah, after studying for 3 months. I have a question. Does the score really matter in the next steps? Like, for example, applying for a training job in the UK. Okay, I was about to answer this question, doctors. The score doesn't matter at all. If you have passed MRCOG 1 with a good score, definitely it's a wonderful achievement. But for the rest of the parts, the score doesn't, if you are like getting 68%, that doesn't mean in part two you are going to get low scores on the basis of this one. You have passed the MRCOG 1, that's all, okay?
Yes, Dr. May is saying that I passed, Alhamdulillah, after studying for 3 months. I have a question. Does the score really matter on the next steps, like for example, applying for training job in the UK? Dr. Lazin already answered your query that no, it doesn't matter. So you can now go and apply for part 2 even. No worries at all. So anybody from the volunteer who have joined our course and passed their exam, do you want to say anything for your mentors who worked really, really hard for for all of your journeys? So we have Dr. Maya with us. Hi, Dr. Maya. Can you hear me?
Hi, yes, I can hear you. How are you?
Hi, I'm doing
Congratulations,
great.
Maya. You made my day. Your score is wonderful, and I'm very much happy. And I was like,
Wallahi,
I was
I
about
really
to
got
celebrate the
surprised.
success
I
of
didn't
students
expect.
with a
I'm
big
so happy
cake.
today.
Oh, so sweet. You should be,
Your
because
day,
it's
you
like,
have to celebrate. Okay, we are waiting for the treat on your side as well.
Yes, we will celebrate definitely. It was actually a true surprise for me. I didn't expect this score. I was waiting to pass or not. Thank you, guys. Thank you for all the team. Thank you, Dr. Mehwish, everyone. You were wonderful.
Thank you so
I
very
know
much.
I joined only the progressive course, and I really, it was hard with the work, kids, and everything. But alhamdulillah, got rewarded. Alhamdulillah.
Alhamdulillah. Many congratulations along with our mentors, our backend team, our CEO, and you all. You really made us proud. Thank you so very much for working hard. We are really, really happy for all of you. Very well done.
Thank you.
we have Dr. Ruhi. She's also sharing the score, 84%. Just one word, Dr. Ruhi. It's a wonderful score. And thank you so much. You are appreciating the mentors. Thank you so much for the kind
Assalamualaikum.
words. Walaikum
Assalamualaikum, Dr.
assalam.
Mehwish.
Who is
Walaikum
oh,
assalam,
Dr.
doctor.
Maria is with us.
I'm Dr. Maria.
Yes,
Hey,
Dr.
Dr.
Maria.
Maria. How are you?
Dr. Mehwish, I just want to say I joined in mid of October and Alhamdulillah, I have done it with 81%. I really, I really was so like that I will not do it with 2 kids and job and all that hectic routine. And I asked once you that should I drop it and I will, I should appear in the July exam. But you said no. And I remember that no, and I tried my best. And Alhamdulillah, within 2.5 months, I have cleared it.
Very
Two and a
well
half
done, Dr. Maria.
months. You have set like high standards for us and for all the students. Like anyone who wants to clear the exam, who is dedicated enough, he can clear the exam in 2.5 months or 3 months or 4 months. I'm actually not saying that it's a matter of 2.5 months, but you can see the dedication and hard work Dr. Maria did, and she has cleared the exam, and now she is happily celebrating this success with us. Dr. Maria,
It's
thank you so
actually
much.
Dr. Mavis. It's only due to your guidance and all of my great mentors.
Thank you, Dr.
That's
Mavis.
great. Thank you so much. Thank
My
you so
husband
much.
is also saying thank you, Dr. Mavis.
It's okay. It's like
Oh.
whole family is celebrating. I'm very happy.
Yes.
I'm very happy for all of you. And yes, the struggle part you shared with your husband, the journey, the phase in which he was helping you, and now he's celebrating with you. All the very best wishes for your best relationship with your husband. I'm very much happy. Like you both are sharing a
We
very
can
like
see
pure
the
and
happiness in your voice as well,
delightful
Dr. Maria.
relationship. Yeah, I can imagine the happy feeling in the voice also.
Yeah, same likewise. Many congratulations, Dr. Maria.
Thank you so much. Thank you.
Thank you so much.
We have some students and a lot of students on the Facebook. They are getting this session live. So we have some students who are going to attempt the exam, Mafia, and this is a wonderful thing that they
They
are
are
getting a lot of motivation from the students who have passed the exam. And this is like a post-graduation exam, so we can't say some students are senior and some are junior, but actually they are receiving advices and they are getting knowledge from the experience of others. They are attending the session and they are getting motivated themselves because hey, 1 minute please. Okay, we have a message from another doctor. She's saying She has got 73%, prepared for 1 month, and she is very happy with the score. Congratulations, doctor. Thank you so much for texting me with the good wishes. And I'm also very much happy for your success. Thank you so much.
I just came to know that Dr. Mariam joined us. Dr. Mariam, are you there? I think so, Dr. Mariam is not here. Okay, we have Dr. Lazine with us. I just wanted to have Dr. Lazine with us. She's really, really brilliant student of Med Exam Expert. Hi, Dr. Lazine.
Hello, how are you?
Hi, I'm doing great. So, how you are feeling now? Are so many students have passed? In fact, I was looking in the study room as well. You were helping so many students. I must say that credit goes to you as well. So what do you say to the students who have passed their exams?
Students who have passed exams are amazing. All of the students that I saw that were joining in Med Exam Expert were great. All of the people who were trying their best, regardless of circumstances, regardless of the results. Everyone was doing the absolute best, and the mentors were really great and guiding. And I think everything that was told during the sessions actually.
I guess there is some internet issue on
Yes, I
Hello?
guess so,
their
because
side.
our voice is lost.
Can you hear
Dr.
me?
Lizzie, if you're... Yes,
Can
we
hear
can.
you.
Yes, we can. You can continue.
Hi, sorry, I'm not sure where did my voice break up.
Like 30 seconds before, so you can continue the talk from 30 seconds back.
I'll try my best. Basically, what I was trying to say, that everything that Dr. Mahesh said in the beginning, when I was very skeptic about even attempting for the exam, she said, if you try, you can get even 10% more. And that was exactly the case. My initial attempt, I got around 53%, and I was like, I'm never gonna get anything close to 60, but then I got 65% this time, and I feel very confident and very positive that it will work out in July. And because I know exactly the resources, I know the team, I know Med Exam Expert is very resourceful, and Dr. Helmi, everyone were amazing and gave exactly great guidance. And hopefully I will have more time in my hands to actually make it through this time. But congratulations to everyone. You've been absolutely amazing.
So I have some words for Dr. Luzine. Dr. Luzine, I will be very honest about this talk, which I'm going to say. There are some people in every batch, they used to inspire us. Their hard work and their dedication to the study is like when such people, they're sharing their personal life, their relationships, their struggle with raising the children, and their job, the hectic routine. When they are sharing everything with us, some people, they inspire us, and you are one of them. So I was inspired by your dedication and efforts, and I was like thinking about my life, that if I am the person in your shoes, I can't do anything like this which you are doing, because uh, you were a top scorer in all the subjects. You are like getting top scores in all the topic tests, and you were taking part in all the live sessions. And I'm very much sure that this is just a hard luck, and this is just you are having some difficult time. But the coming exam, you are going to lead the celebration session in the July, and I'm very much sure about your success. And you will keep inspiring me with your hard work in coming batch also. So good luck for the coming exam. I'm sure 100% sure that you will make it. Okay.
Thank you very much, Dr. Mahesh. Thank you.
Yes, inshallah, she will make it. No worries at all. Okay, Dr. Mavish, we have Dr. Amna with us in the chat box. Okay, hi, Dr. Nigar. Thank you so very much. Congratulations, everybody. Hi, Dr. Amna. Walaikum assalam. Oh, Dr. Amna is passed. Many, many congratulations.
Congratulations, Dr. Amna. Alhamdulillah and Walaikum Assalam. I'm very happy for you. Dr. Nighat is also with us. Walaikum
Yeah.
Assalam, Dr. Nighat, and congratulations, congratulations. A lot of happy students, a lot of students, more motivated and more excited for the coming parts.
Exactly. Dr. Mavish, we will not accept their thanks without opening up their mics. What do you say? Yes, we want to listen the cheers in their voice. What do you say?
Dr. Kurat is again telling me, Dr. Marish, I'm also passed. Dr. Kurat, I'm sure that you have passed the exam and you have told it before. Again, congratulations. I wrote the
Yes, but
congratulations in
take
the
thanks
message. You can
on
open up the mic and
mic.
talk also. Thank you, Dr. Ramna. Dr.
Dr. Amna, we
SK is
want you to.
here.
Yes.
Dr. SK is also
Dr.
saying
Kurat is
cleared. Okay,
okay.
exam is
Dr. Mavish,
cleared.
it's so cute. Yes, Dr. Mavish, I just wanted to tell that it's really so cute. Dr. Kurat is saying, I'm so happy that I wanted to tell again and again. So if you wanted to tell Dr. Kurat, you have to open up your mic. Just give us just 5 minutes. Please open up your mic. We want to see that how much happy you are.
Hello, hello everyone.
Hi,
Can you hear
Yeah,
me?
this is the voice. Full of happiness, full of excitement.
Literally, Dr. Mavish,
Congratulations.
when my husband was opening my account and it was not released yet, and I was continuously contacting the med exam team, and they said that it will be released. Some of students haven't got the result, and I was thinking that. Yalla, please give me 68%. at least give me 68%. Then when my husband told me that you have got 80%, then I was about to faint. That I was.
You want to listen this excitement, Dr. Kurat. That keeps.
Thank you so much, all of the med exam team, and it has increased my knowledge as well in my clinical practice, and I am applying this knowledge, and I'm very happy that I am now have learned good skills as well.
Yes, actually, this is what we want our students not to just pass the exams. We want them to learn. That will help in later in their lives as well. Very good job, Dr. Kurat.
Thank you so much. Thank you so much.
Okay, we have another wonderful person with us, Dr. Talia. She said, Alhamdulillah, I have passed the exam in my first attempt. Highly grateful to my exam expert. Many, many congratulations, Dr. Talia, but we will accept this thanks and grateful message. But if you will open your voice, Mike, thank you. Same goes for Dr. Amna for you as well. Just open up your mic just for 5 minutes even, if you want.
Thank you, ma'am. I'm Dr. Talia.
Thank you so very much, Dr. Talia. Congratulations. How are you feeling?
Congratulations,
It's
Dr.
awesome,
Talia.
Ma'am, I am from Bhutan. I'm Bangladeshi, but working now in Bhutan. So for me, the exam was very tough. And I have to fly to Delhi to attend the exam, as there is in Bhutan, there is no exam center. So I have to fly Delhi with my 2 kids, with my husband. It's very troublesome for me, only for 7 days, because I have very tight schedule here to get the leave. And this very tough journey, it was easy for me, only for you, ma'am, and your team and med exam. Otherwise, I could not manage it, and I can't imagine to give the exam also. Thank you, thank you. I'm highly grateful to med exam.
Thank you so
Dr.
very much,
Talia,
Dr. Talia.
you are
Really
again
wonderful.
inspiring a lot of people by sharing your journey, because a lot of
Thank you,
doctors,
ma'am.
they are like they are having a similar life like you. They are struggling with raising the kids, and they're struggling with hectic jobs, because obstetrics and gynecology is never an easy field for any doctor working in this. So you are again inspiring a lot of people that in despite of having this life, you can clear the exam, because it requires help and a lot of dedication, and yes, a lot of hard work from the side of the student as well. So I'm very happy for you, and the way you shared Actually, you are just sharing the whole journey in 4 to 5 lines, and you know better, you know best that how difficult it was. And definitely, your family is very cooperative, your kids are cooperative, and definitely they must be suffering because when you are preparing for the exam and you are not taking a lot of time for the kids, they are suffering. But in the end, when this day comes, the result day comes, you are getting reward in the form of a great score. So this is something for which the whole family was working. So congratulations to you and your family and the coming success when you will become a complete MRCOG, and that success is like a great aim. And I wish you best of luck for all the coming parts also.
Thank you,
Yes,
ma'am. Thank you very much.
thank you very much, Dr. Talia. Dr. Mavish, there is a message for you that you are loved for some of the students. They are saying, Dr. Mavish, you are loved. You helped a lot. I'm really thankful to Dr. Helmi, Dr. Desri, Dr. Mavish. Again, it's Dr. Amna, and we have Dr. Negat. She's saying thanks to all the mentors. Dr. Negat, it's especially for you and Dr. Amna. We will not accept your thanks in if until and unless it's in the form of voice. So please open up your mic just for 2 minutes and tell
Not
that how
accepting
yes. Otherwise, we
accepting
will
the
not
thanks.
gonna accept it.
I have
Yes,
never
your
ha-
part
I-
two
I've
is
never
still left.
I've never heard something like this, that you are not
Okay,
accepting
ma'am.
it. So I'm enjoying this. So students, please turn on the mic
See?
and do
Yes,
some
ma'am.
conversation with Mafia because she's not going to accept
Yes,
thanks.
we have Dr. Negat.
Yes, ma'am.
Yes, exactly. So,
Thanks
hi,
to
Dr. Negat.
mid-exam. Yes, ma'am. Thank you so much, Dr. Mavish, Dr. Helmi, Dr. Risi, and Dr. Ramya. All the mentors, they help a lot, and it's very difficult for me as there's a big gap after my house job, and then I did it like it's been a 9 to 10 years gap, ma'am, and I did it in first attempt. I'm so happy. My family, especially my husband, my kids, they
That's
are very
wonderful.
happy with me and they are very excited and they are celebrating this. And it's just because of med exam expert and your efforts, and no doubt the Allah Almighty's and my parents. Thank you so much, ma'am. Especially Dr. Mavish, you all time
Thank you
motivate
so
me,
very
and
Thank you so much, Dr. Nigat. I have told
thank you,
before
ma'am.
that students keep sharing
much.
their struggles
No
during the
need to
preparation
cry, no
time,
need to cry.
and
It's
I
right.
knew that you were working a lot and a lot. Your hard work is really inspiring. Thank you so much. I
Thank
have
you,
got
ma'am.
another message
Jazakallah.
from a student, Dr. Fayo. So I'm mentioning him because again, he's a trainee and he is working in Ops Gynae. And the last attempt, the September attempt, he couldn't attend because right before his exam, the exam cancelled in the UK. Now he has taken the exam and he has cleared it with 80%. So it's a wonderful score. A lot of congratulations to Dr. Fayo.
Oh,
I'm sure he's going to join the
wonderful.
meeting. So we will talk to him also. I'm getting a lot and a lot of messages. And
Okay,
everyone
actually,
is like, I got 80, I
actually,
got
I'm getting a
85,
lot
I
of
got 87, I got 91. So wonderful. Everyone who got this score,
That's wonderful.
I'm very happy.
Dr. Amna, do you want to say something? You just open up your mic. So I was wondering that you wanted to thank your mentors.
Yes, Alhamdulillah. Um, I want to thank Dr. Mavish, Dr. Desri,
That's
Dr.
great.
Helmi. Dr. Mavish, I am really, really grateful to you because you were always available for us. And honestly, I could not make it without med exam expert. And I was so scared of the exam that I did not check any recalls or anything after exam because I had really bad headache during exam. So I was quite nervous. I was thinking that I will fail this exam because I did not know what I wrote in the exam, and I was so nervous. But all thanks to this platform and obviously our families, and I'm really thankful to you, all my teachers.
Thank you so very much, Dr. Hamna. Actually, Dr. Mavish, why I am forcing my students to just open up their mics, because they don't know they will be an inspiration for somebody in the, like, maybe somebody's in their room, and they are just wondering that maybe I will pass the exam or maybe not, because I am having 2 kids, or maybe I'm struggling. Let's say the way Dr. Talia explained that she was like traveling 5 or 7 days, and with their kids, with her husband, and a lot of struggle she made. So I just wanted all of you to just tell your journey. It will help a lot of students, a lot of students who are working in maybe in very difficult times. So please, whenever you are passing or acing any exam, just open up your mic, just tell your journey. It may be help any students who are sitting anywhere in the world, you can say, because we are, as an international organization, we have a lot of students. We have students from different countries, from India, Pakistan, Bangladesh, and a lot of others.
Hello, ma'am.
Yes, I'm
Hello,
sure,
baby.
Mafia. Hello, doctor. How are you?
Hello, I'm Dr. Ruhi. Hello, ma'am. I'm
Hello,
talking to
Dr.
you for the
Ruhi.
first time on live.
Hi, Dr. Ruhi.
Hello, ma'am. Actually, I'm
So
very,
much
very
happy for
thankful
you.
to Made Exam Expert. I'm from Nepal. Actually, for me to pass this exam is like a dream. In my country, many people do not give this exam at all. And I met only one or two person who gave me the real journey knowledge, what they have gone through. So I was like, what do you call, I was in despair how to go through this, how to prepare, how to what books should I collect, what information should I get it. So no one actually told me what to be done. Then when I got, suddenly one day when I was scrolling through Facebook, I got this Made Exam Expert was doing some course like that, and I joined in end of this September. And I feel I was, maybe the God has thought that she should do it, or she is one who deserves. So I met Made Exam Expert. I'm thankful to God for bringing Made Exam Expert into my life. Uh, Doing all the house jobs, working as an obstetrician and gynecologist, and then doing duties, looking at a child, taking responsibility. It was so hard, so hard. Each time when you post some questions on the study room, I hardly get time to go through on that day. And after 3 or 4 days, when I go through those, I used to regret that I couldn't give much time. And especially I see Dr. Luzine, Dr. Leela, Dr. Rai, and I forgot a few more names, Dr. Maria. And when they are writing something, I quickly go through them. I'm thankful to them also, actually, to colleagues. And I'm very sad for Dr. Luzine. Just now she said she couldn't get through it. And actually, I'm thankful to her as well, because they really help. And after passing now, I just feel that all my mentors were so grateful. They had precise, they just have precise their PowerPoints. Their PowerPoints are precise, concrete. And Dr. Mavis, those 1,000 questions that you did for 5 days, like they were boons for us. Really, Dr. Mavish, I'm thankful to you, thankful to Made Exam Expert. Thank you to Dr. Helmi, Dr. Desri, Dr. Ramya, and all the colleagues in the study room who shared the questions daily. At least I go through once a week or twice a week, but still all those questions help. I couldn't go through all the recalls. I couldn't go through all the mock exams. I couldn't go through all the flashcards that you have provided, but still it helped really. And I'm thankful, Dr. Mavish. Thank you to you so much.
It was so relaxing while she was talking. I was
Yeah.
hearing and I was thinking that she shouldn't stop. Thank you so much,
Yes,
Dr.
Dr.
Ruhi.
Mavish.
You were summarizing a difficult and long journey in few
Yes,
lines.
yes.
And I will say
Really,
you are
it's a
inspiring a
long
lot
and
of
difficult
people.
journey, yes.
And
When
the
nobody
juniors,
tells you, when nobody
yes.
tells you what to do, and you meet Med Exam Expert, like you met a god. it's like that. So thank you, Dr.
These are
Mavish, for
some
being
great words. I
24/7.
truly doubt that if
Yes,
I
Thank you
deserve these
so
words or
much,
not,
Dr. Mary.
but I am
Okay,
yes,
very much
ma'am.
sure the success you
Dr.
have
Mary,
got,
I have a
you truly
question.
deserved it.
Yes,
Yes,
no, that.
thank you so much. Thank you
Yeah,
so much,
Dr.
and
Rohi,
thank
I
you,
have a
Dr.
question from you.
Lizzie. Yes, please.
Yes. Okay, Dr. Rohi, I just want to ask because a few of our students ask us this question in free groups as well. They have all the material with them, but still they think whether we should take some guidance or not. You have already passed your exam, you have joined Med-Exam Expert course as well. So what do you suggest to those students? Still they need some guidance if they have all the material. What do you say?
I think they should only join Meg Exam Expert. Whatever they say, whatever they provide, that's enough. That's really enough. For last few weeks, I got only 10 days to revise all the materials that Med Exam Expert gave. I mean the PowerPoints. All the PowerPoints are very precise, but still I didn't have much time to go through again. But anyhow, within that 10 days, 24/7, I tried to recall, because 10 days I took a break from my job, and I told them I couldn't come. Please give me those 10 days holidays. And then within those 10 days, I revised all those PowerPoints day and night. And then that was more than enough. And last 5 days, that 1,000 questions that we did together, oh my God, those were very, very benefit. With those extra that Dr. Mayavish posted, those explanations, not the 1,000 questions, they become 2,000 questions actually. So it was so helpful. I mean, I was really scared to give the exam because I didn't go through all the recalls. Even though Made Exam Expert provided in the this course, I couldn't go through all those recalls. Really, I couldn't because I didn't have much time due to duties and child and responsibilities. I was so scared when I was going through the exam also. But thankfully, those 1,000 questions became 2,000 for me. Those PowerPoints became completely a book for me. And I went through only that revision notes. So no other books. So really, with those only, I got 84%. I'm happily surprised. I'm thinking that how could Dr. Luzin could not make it this time, because she was one of the active member in the study room, and when she doesn't get means, I feel that how I got it, I was
Okay,
lacking.
Dr. Ravi, I would love to answer this
Sometimes it's
question or this
luck.
confusion.
It's luck as
Sometimes
well.
this is not
Yeah.
about the clinical knowledge, the knowledge about the study, knowledge about the books or following the course. Sometimes it's not about this thing only. Sometimes a person is struggling a lot in their personal lives. So
Yes,
it's
ma'am,
just a difficult
maybe.
time and it's just a difficult phase. And we have seen her doing this hard work in the group, and we all are like we are evident that she was doing so well, and she will get the highest score, I'm sure. So the second thing I
Yeah,
would say, Dr. Ruhi, you are a great person to appreciate
thank
everything regarding the course, but the way you are mentioning everything, it's like
you.
it's like from both hands. But exam is giving you
Yes,
the course and all the hard work from our side, but you are also the one who is doing the struggle and the hard work. So a lot and a lot of credits
Yeah.
for you only, and you are the one who deserves this success. And I'm sure in the coming parts of MRCOG, you will keep doing this hard work and you will get a wonderful score in part 2 and part 3 as well. And
thank
Dr. Mafia, I want to ask, what is the special offer for students who have passed the exam and they are going to attend part 2 as well with med exam?
Yes. We have offered a special discount for all those students who are almost we have all students who have passed exam. For so far we have our success rate is 98%, alhamdulillah. So I will say that I will reveal that in a couple of hours, because we have a lot of students, so we have to see that, and we will announce special discount for our part 1 students.
Again, doctors, I would say that there are some members, some colleagues who couldn't clear the exam. I'm going to say just one line for them. This is not that you are not capable of passing the exam. It's actually some situations, some difficult situations in your life, and we are here to help in the coming attempts. You don't have to like feel down about yourself. You are already the person who has achieved a lot and a lot in the life, and the coming exams will be more easy for you to take. And I believe everyone's family is more important than the study. I'm sure if a person is going to attend the exam, but there is a baby who is crying, so a mother just can't study, she will go to the baby. So these are some difficult situations we face in our daily life. The post-graduation life, once we are done with MBBS, the post-graduation life is full of struggles. It's full of it's so challenging. You have to be very, very positive about everything is happening in your life, and life is difficult. But with the hard work, with the help of others, like the med exam team is with you in the struggle of MRCOG, and for other struggles in your life, there must be some helpers. So know from where to take the help, and know that how to utilize this help, and always be very, very positive about about the events happening in your life. So thank you so much, Dr. Lizine. I'm sure you are going to attend the July batch also. All the other students who are going to attend the MRCOG2, they should be in contact with med exam team, so they can offer you and they can guide you when to take the part 2 exam. Mafia, when we are conducting this session, the guidance session for students who are going to take MRCOG2?
It will be like day after tomorrow, inshallah. But I would say
Inshallah.
for all the students, yeah, for all those students who have cleared the exam, they can enroll in a part 2 course, because we have already started preparation for our part 2 course. So for all those, we advise you to take our part 2 course after celebrating your part 1 exams, like result, after celebrating your result and all the excitement. Once you have done with that, like if you want to take 1 week, you can take rest for 1 week, then after that you must have to come in the part 2 course, okay? So it's already started. You can just come and start your preparation with us.
And here I want to provide some guidance as well. Dr. Helmi is unluckily not with us. He is the right person to get this guidance from. But actually, I'm also a student of Dr. Helmi. I'm not only his colleague, but I'm a student also. So I'm just repeating his words. If you have clinical knowledge, a clinical background knowledge for OBS gynae, you can take the exam, like coming attempt in the July, you can take the exam. But if you are deficient of clinical knowledge, then you should have like 6 months or 1 year gap between part 1 and part 2. And there's a doctor asking this question in the chat box as well. He's asking that there should be a gap period between part 1 and part 2. Ideally, there should be no gap, because after part 1, without attending any training and without showing any training to RCOG, you can attend part 2. But what we suggest that if you are deficient of clinical knowledge in OBS gynae, you should take like 1 year for the preparation. So this 1 year, I'm not saying you will be just sitting at home and doing nothing. You will be reading, but the reading period, the preparation period should be 1 year for the students who are like freshies in the OBS gynae. And for the ones like consultants and specialists of OBS gynae, they can take the coming attempt. Okay, I'm getting a call from our student, Dr. Nadeem.
Okay.
Team, can you collect the result and inform about it? So everyone who is part of this session, thank you so much for joining, and thank you so much for sharing the experience. Thank you so much for appreciating words for med exam team. There is a wonderful part of our team which I want to appreciate today for their encouragement also. We have a wonderful, so much active and so energetic backend team, the administration. Mafia is the one who is leading the team for MRCOG-1, and everyone who is the part of this team, they're so active, and I can't imagine having a course or running a course without having such team. So we all are mentors who are teaching you, but the ones who are sitting in the office and working like behind the screen, they also require a lot of appreciation, and they really work so hard that if everything is going so smooth in our course, it's because we have a wonderful admin and technical team. So thank you so much, MedExam team, MedExam mentors, MedExam technical team, administration team, everyone who is working for the students. You are wonderful, and we have world best MRCOG-1 preparation platform. So thank you so much again, and we
Thank you
will
so very much.
see you
Thank you so very
in
much,
the
Dr.
comment
Naresh.
session. Thank you, Mafia. So we are seeing the students in the coming sessions. We are organizing sessions for the ones who have passed the exam, and we are organizing sessions for the ones who couldn't clear and they want to discuss what could be the reasons for the failure and what they should do for passing the exam in the coming attempt. Okay, good luck from my side, and bye-bye from my side.
Thank you so much. Thank you so very much, everybody, and many congratulations. Party hard will meet again in part 2 course, and definitely for all those who couldn't make this time, we are here to help you all. We have prepared some special schedule for all of you to pass your exam. Thank you so very much. Good luck. And